The next category of antiemetic drugs is known as the phenothiazines, and these are discussed on page 246. And I know there's a table. Yes, it's on page 244. It's the one at the top. Our prototype drug, the most commonly used drug, is a drug called promethazine or Phenergan. So this drug works primarily to block dopamine receptors in the chemoreceptor trigger zone of the brain. So that helps it to reduce nausea and vomiting. It has a small antihistamine effect, but that would be blocking histamines in the GI tract rather than in the respiratory tract. But rather than blocking serotonin, we're blocking dopamine this time. So that's going to help reduce nausea and vomiting. Of course, we know the most common side effect of Phenergan is drowsiness. And they say drowsiness the way they say, you know, like the Atlantic Ocean is a body of water. I mean, in my experience, if I have Phenergan, I am down for the count all day long. But it's going to make you sleepy. It can blur your vision because it dilates your pupils. You get a dry mouth. You can be very dizzy. So Phenergan is a falls risk. A patient on Phenergan is usually a dizzy patient. So they need the bed low and locked. They need the call light at their bedside. Now, in severe cases, because we're messing with dopamine, remember, we can end up with tardive dyskinesia, acute dystonia. So you're going to be looking for patients with weird, unusual muscle movements of their face, strange twitches and movements in their extremities. It is possible for Phenergan, especially in higher doses and given more often, to cause neuroleptic malignant syndrome. So remember that that is a life-threatening situation where you're usually going to see extremely high blood pressure, tachycardia, sometimes mental status changes. So you want to watch out for that. Any drug that affects dopamine, whether it increases dopamine or cuts down on dopamine, is going to interact with Phenergan. So if you have a patient who is a Parkinson's patient and is taking Sinemet, Phenergan might not be the best choice for this particular patient. It's going to interact because it tries to block dopamine receptors. Nursing implications and patient teaching. Make sure you read the nursing implications on the phenothiazines on the top of page 244. This can cause orthostatic hypotension and drowsiness and dizziness, like I said, a falls risk. Don't use alcohol when taking this drug. They don't mix. Alcohol is going to make you dizzy and drowsy. Phenergan's going to make you dizzy and drowsy. That's, you know, your central nervous system getting affected twice. Watch for Parkinson's-like symptoms because of that blocking of dopamine. And watch for sudden increase in temperature. Like I said, neuroleptic malignant syndrome can really be dangerous. Now, back when I first started nursing, we gave Phenergan pretty much any old way I've seen it given, like straight IV push into an INT. Miserable, this drug stings like crazy. There have, unfortunately, been cases of patients who have gotten necrotic tissue in their hands and arms from getting Phenergan without it being properly diluted. You can Google it, damage to skin from Phenergan. It's pretty grisly. So now there's a strict facility protocol when you're giving Phenergan IV. It's usually now diluted in a bag, at least 50 milliliters of normal saline. Instead of just being injected, it's infused on a pump over a half an hour. Usually no more than 12.5 milligrams because of these problems they've had with the necrosis.